to share some information, some knowledge, some content on a topic that I get questions about all the time. Today's topic is demystifying the alphabet, a very general overview of LGBTQQIA. This is meant to address a range of knowledge levels, but mainly, again, it's a sort of a very general conversation to help people who feel like they have some clarity lacking just on understanding what the letters refer to and how gender identity, and sexual orientation all fit together. So I encourage you to put any questions that you have in the comments, and I will try to respond to those as quickly as I can. Offensive comments will be reported, but if your comment is coming from a place of true interest for information, then I will attempt to respond to those. And I want to be clear that my goal is not to change your personal value system. It's just to offer information and hopefully to allow you to have information that you can put into context, and then you can draw your own conclusions from there. So a little bit about me. I'm Dr. T, as I mentioned. I identify as cisgender, heterosexual, and I try to act in allyship as much as I can with the LGBTQ population. I have been a faculty advisor for a Gay Straight Alliance student organization, as well as an equity and inclusion training associate, where I supported and assisted our safe space program at a local college. I've completed my own ally and safe zone trainings in the past. I previously taught at the college level, human development and human sexuality. And my doctoral dissertation was on the intersection of race, religious identity, and sexual orientation. So I say all of that to say I have a background for this information, this content, this knowledge. I have a true passion and interest for it. All of that being said, I do not have all the answers. In addition to that, I do encourage you that if you need a training on this topic, particularly if you want something that's more in depth and you're willing to pay someone to come in and train, I encourage you to look for an LGBTQ professional who can provide you with those types of trainings. It's best to find people within the community who are able to speak on their own communities. However, I'm always happy to bring my perspective as an LGBTQ ally, and I've done that in the past. So again, if you have questions, feel free to drop those in the comment section. I would love it if you would like this video. And subscribe to my channel, as this will probably be a 2 or 3 part series, because there is a lot of information, even though it's meant to be a very general introduction. So I hope you'll learn something new. And if there's anything in here that you feel like is inaccurate, let me know, okay? So when we say demystifying the alphabet, essentially what are we talking about? So we're really talking about some of these labels, and I'll be trying to define either in this specific video or I'll actually have a follow-up video. This one will focus on gender identity, and then I'll have a follow-up video on sexual orientation. And there will be a little bit of overlap between the two. But I wanted to kind of separate the topics for those who want information on one or the other. So overall, between the 2 or 3 videos, the topics will be an explanation of labels like lesbian, gay, bisexual, transgender, and queer, which is LGBTQIA+. Q. Sometimes you will also have another Q added on for questioning. Occasionally you may hear IA added on as well, intersex and asexual. And sometimes you may hear other terms used for those letters, depending on what part of the country you're, what part of the US you're from, or where your geographic origin is, or other cultural differences. So I'm also going to touch a little bit on homophobia, and I've tried to give you a little bit of information about what it means to be an ally, to support and affirm the LGBTQ population. So we're going to start with the basic terms that often get folks confused. So what you'll find is that sex and gender are two terms that are often used interchangeably, but they aren't really the same thing. So sex is whether you're biologically male or female, and we're actually going to talk about what that means. Whereas gender is all of the psychological and social characteristics that are associated with being male or female. It's socially constructed, right? So it is defined by a person's gender identity and learned gender roles. So things that we learn growing up about what it means to be male and female. But actually being male or female is sex. All right, so those are very basic definitions. Now this question comes up a lot, but you can only be one or the other, right? Like, that's just kind of basic biology. Interestingly enough, the answer is no, not necessarily. So this idea that sex is one or the other is called binarism. So we talk about the gender binary, right? The expectation that you are either male or female. And really, science tells us, well, okay, sort of, kind of, but not really. And for those of you who are like me, who like for things to be very clear, very black and white, very structured, I understand that that may create a lot of anxiety for you, but I'm going to try to clear up at least some of the confusion about that. All right. So when you hear people talk about the gender binary, that means the idea that gender is one or the other. And so when people refer to themselves as being non-binary, for them, that can mean a few different things. That they may not feel like they are one or the other. It may feel like sometimes I'm one, sometimes I'm the other. Many folks will look at it as more of a continuum than a binary. And many people look at gender as not necessarily being stable, whereas we're often brought up to think about sex and gender being pretty stable. Like, okay, you're born a boy, you stay a boy, you act like a boy, you do things like a boy your whole life. Not everyone feels quite that way, that it's as black and white or as stable as we're sometimes taught. So part of the reason why we believe the way that we do is because of gender role stereotypes. And sometimes this is referred to as sex roles, right? The preferences that we have for how men should act, how women should act, or how males should act, and how females should act. For example, you know, we think that girls are sensitive and boys are dominant. And, you know, the old song story, little girls are made of sugar and spice and everything nice, right? And puppy dog tails, and always forget the words, but that's what little boys are made of, right? So we have these stereotypes in our head. These are oversimplified beliefs about the differences between men and women. What you'll find is that these are socialized from a very early age, even before birth. And if you go and watch my gender reveal video, you'll get a little bit more information about that piece of it. That one's actually pretty short. So what science tells us, in contrast, is that men and women are more alike than they are different, but we emphasize those differences so much that they stick in our head that, oh, this is the way that it is. We say things like the opposite sex, right? And it gives us the idea that, oh, we're so very different, when in fact, we're not that different. But just like you find with most other biases and stereotypes, those differences are emphasized by society. Why? I already told you, because people like me like to be able to categorize things and stratify things and, separate things out. And so, a parent who has a son who chooses to wear nail polish or likes to play with dolls, what reaction are you typically going to see in those kinds of situations based on what we've said about how society socializes us when it comes to sex and gender? Right? So research tells us that as early as 2 years of age, parents will typically have a strong reaction to their toddlers going outside of those gender norms or those gender stereotypes. Playing with the wrong type of toy will typically cause a reaction in the parent, and those reactions are typically noticeable by your child. If you take the toy away from the child, if you say things like, no, you shouldn't play with that. If you spank them for playing with a non-sex appropriate toy, those kinds of things, right? Children notice those things. And it definitely sends a message to the child about what's okay, what's not okay, what it means to be a boy, what it means to be a girl. Now, what we also know from the research makes this very interesting, that we socialize children to conform to these gender roles, but androgynous people tend to be more adaptable in the world. And androgynous refers to people who have less stereotyped behaviors when it comes to those gender roles. And so nowadays we kind of refer to things like being gender fluid, for example, people who stereotypically don't dress so feminine or so masculine, that, it could kind of fall somewhere in between. Or if they have characteristics that are less gender stereotyped, not so sensitive, not so masculine, but kind of midpoint. Those folks actually tend to be more adaptable overall, which actually makes sense. But we continue to push those stereotypes, again, for the comfort of the rest of society, typically. So just a reminder about those terms. Sex is whether you're biologically male or female. Gender are all the social things that we connect to maleness and femaleness. All right, so I'm going back to that for a reason, because of this next slide. These are all of the different dimensions of sex. So when we talk about is somebody male or female, there are so many pieces of it. In my gender reveal video, I talk about the fact that we usually predict what sex a person is going to be by determining by an ultrasound whether they have a penis or not, right? We make it that simple. You have a penis? If you have a penis, you're a boy. If you don't have a penis, you're a girl. Now, there's a whole lot of sex-based messages wrapped up in there, right? The importance of a penis, number one, but other things. So what I'm about to tell you is that that's a really ineffective way to do it. Looking for a penis, that is. So these are all of the various dimensions of sex. These are actually all the pieces that make up sex, and in some ways gender. So at a very basic biological level, you've got genetic sex. So if we look at your chromosomes, what do they tell us? Now, typically, XX means you're female, XY means you're male. Binary, right? Well, not quite. There are also additional possibilities. Yeah, there's XO. Where does that person fit? What about XXY? So no binary on a very basic biological genetic basis. No need for the binary. So that's just one piece. What do your chromosomes say? Then there's also something called gonadal sex, which refers to the gonads. So inside your body, do you have ovaries? Do you have testes? All right, ovaries typically play one particular role in reproduction. Testes play a separate but important role in reproduction. So what you'll find is that most people in the general population will have one or the other, and in some cases none. But we assume that everyone does have one or the other. And what we also assume is that those things align with your genetics. But I'm going to come back to that. So another dimension, we already done two, we've got another one. Another dimension of sex is your hormones. Do you have more androgens, things like testosterone, or do you have more estrogens? Now, people will sometimes talk about androgens as being masculinizing hormones because they can have an impact on certain types of emotions, on things like being able to build muscle mass in some ways, and some other factors. But they also contribute to organs that are created in the body, like testes. And then we also often refer to estrogens as feminizing hormones, mainly in some way because they have an impact on the ovaries, but androgens do too, can impact the ovaries. So again, but we like to put things in a box, so we find a way to box it. So I say the predominance of hormones because men and women have estrogens. Men and women have testosterone. Theoretically, the levels of those, particularly at different times of the month, should be different. So you combine with that this fourth one, which is genital sex. Now this is how, as I already mentioned, we typically determine the sex of a child, right? Because we expect that girls have a clitoris and a vagina, and that boys will have a penis and scrotum. That's what we expect. Sometimes that happens, sometimes it doesn't. So then you take all of those dimensions of the actual sex and combine it with a couple of dimensions of gender. And so those relate to gender identity, how I feel as far as being male or female. Do I feel a certain sense of maleness or femaleness? And then gender expression, how do I choose to display that maleness or femaleness to others or to myself even? Now here's the kicker, right? I kind of alluded to this. We expect all of these dimensions to align, but they don't always align the way that we think they should. So what does that mean? That means this is what we expect. We expect that if you have an XX on your chromosomes, for your sex chromosomes, then you should also have ovaries as your gonads. You should have higher levels of estrogens. You should have a clitoris and vagina. You should feel female and feminine, and therefore you should act and dress female and feminine. That's our typical expectation, right? Right. But again, these factors don't always align the way that we think that they should. There really can be any combination of these characteristics. I already told you that genetic sex isn't just XX and XY, right? And so you could have For example, someone who was XXY, who had testes internally, and maybe no penis. Maybe they've got more of a clitoris. And in that case, how do we expect that person to identify? Should they feel male? Should they feel female? It gets more complicated, right? So that's kind of what I wanted you to get out of this. Is that the things that most of us have been taught growing up really oversimplifies this. And in the course of attempting to make things simple for people to understand, what we've really done is marginalized and excluded people who do not fit the norm, right? Because we've tried to create this box and we've essentially said, if you don't fit in that box, you're not normal. That's really an inaccurate way to conceptualize this. So in case you're wondering, how does all of this happen, right? Now that your mind's a little blown. Some nerd stuff, right? So our chromosomes, those sex chromosomes like XX and XY, they're believed to initially determine our sex. But again, even that's not binary. So once you have that on the chromosomes, that's then going to impact your hormone production, which hormones you produce, how much. That hormone production will also impact brain development, how you shape the brain, what hormones are produced there. And then that's also going to impact that, and the hormones will impact the physical characteristics, whether you develop breast or not, whether you develop testes or not. So it's all this system that works together, but there are these very complex pieces interacting, not just one thing that determines it, they're all interacting to create you, me, all of us. So what we do know from science is that at birth, males and females are pretty much indistinguishable, but we all start to go through what's called differentiation early on in development during the first trimester. And that's essentially that first part of differentiation. The hormones have already started to affect brain development and physical characteristics of the developing being. And then those primary sex characteristics will start to mature, and the secondary sex characteristics start to mature once after the person's born and after they start going through puberty. That's still impacted by hormones and brain development. So there's just so much. So let me try to bring all of this back together again to unblow your mind. So when we're talking about sex, gender, right? Sex is the biological piece of it. Here you can see a representation of the other aspects there related to gender with our gender unicorn. So gender identity is in my head, how I think about myself, how I feel. Gender expression is how I choose to wear my hair, dress, talk, all of those kinds of things. The sex assigned at birth is the biological piece of it, right? It's internal. And then in my next video, we'll talk about who one is physically and emotionally attracted to as that relates to sexual orientation. But for now, I'll say this. When it comes to the gender piece, right, a related question, or why I often get questions about sex and gender, is because many people want to understand, well, what is transgender and how does that happen? So hopefully the information I've given you so far helps to explain how that happens, how a person could be assigned a sex at birth and then not have that align with their gender identity later on in life. Because we use a very inaccurate process we're determining that sex before the baby's born, right? Or even once it's born. So here are some terms that are related to the idea of being transgender, and you may hear different words for it, but essentially transgender means I was given a label at birth, male, female, and as I grew up, I decided the label that I was given just didn't fit. It didn't feel like it fit for me. Okay, so we're not sure whether that's due to the genetic sex, the hormonal sex, the gonadal sex. Could be any of those things, or a combination. We don't really know. So here are some additional terms that kind of go along with that you may hear other people use, that we all kind of throw into the transgender box. And I hate to say it that way, but that's essentially what we do. Like, okay, all that's the same thing. It's not quite same, but related. So I already mentioned androgynous, right? On that continuum of really male, really female, being, presenting, acting. Those who are androgynous are more in the midline. You may also, in some indigenous populations and in some other cultures, you may hear it referred to as being two-spirit, having masculine and feminine entities or energies or spirits. You may hear some people refer to it as being genderqueer, as being bigender. Transsexual is not used as frequently as it used to be. It's kind of an older generation term that essentially meant a person who transitioned from one sex to the other, or one gender identity to the other. Trans woman, trans man. It's just short for transgender woman, transgender man. Intersex is one of those letters on the LGBTQIA acronym that refers to typically a person who lacks alignment biologically. So often it will be someone who has genitalia that you can't really determine whether it's a penis or not. So during that period of differentiation, the genitalia just didn't come out the way we expect, either with a full penis, nor is it quite a clitoris and vagina. So you may sometimes, it may sometimes appear that the person has both or just not quite differentiated forms of one or the other, typically. Now, sometimes you'll also see a misalignment with the internal organs as well in persons who are intersex. And there are other terms and labels that are always changing, because for this population, it is important that you allow folks to label themselves. And really, for anyone, not just the LGBTQ population, if I tell you my name is, I don't know, okay, Dr. T, call me Dr. T. Thank you, I appreciate it. So that idea of self-labeling is very empowering. And it is one of, for me, the foundations of this work is saying, you should allow people to self-identify. Who's better to say what to call me? Me or you? So I did want to share some of the terms that, for example, if you use them in the comments, you'll get blocked. And words that maybe at one point were used, but they are quite offensive terms. They have grown out of favor. So please, these words, don't use them in reference to folks who are a part of the LGBTQIA population, not those who are transgender. And there are a few reasons why those last two have just sort of fallen out of favor that I won't go into here. But if you'd like to know more, feel free to reach out to me. So I am an intercultural affirmation coach. I would be remiss to not talk about what true affirmation looks like for this population. There's a lot of space in between being offensive and actually being affirming. And so sometimes, it's just helpful to know what that is. I would say it's not enough just to have positive, fond, or admirable feelings towards an individual who's LGBTQQIA. It's about what can I do to actively affirm this population. So if you're going to make a comment for or about the LGBTQIA population, take any aspect of your identity and replace the word that refers to the LGBTQIA person and replace it with a similar word from one of your identities. And if you hear that phrase and you think, oh, I wouldn't want anybody to say that to me, then you probably shouldn't say that comment to the LGBTQIA person. So for example, if you wanted to say something like, you know what, I like transgender people. Before you say that, replace transgender with, like in my case, Black. If someone came up to me and was like, I like Black people, do you think I'd be offended? You don't have to guess. I'm telling you I'd be offended. So why would I go around and say, I like transgender people? Check yourself before you wreck yourself. Let me give you another example in case it hasn't sunk in yet. Your religion doesn't bother me. Well, why should my religion bother you? Right? So why would you say, who you choose to sleep with doesn't bother me? Your sexual preference. Get the picture? Let me go ahead and give you a couple of others just to make the point. I'm so glad we work together. I find blind people to be so interesting. Do you now? Or, I don't see your gender, I just see you. Is that so? All right. So, hopefully that's enough examples for you to get a clear understanding. Some other things that you can do to actually be actively affirming, besides not saying any of those examples I just gave you, is to become an active ally for people within your community who are LGBTQQIA, to address, if you hear any of those comments that I just gave you as examples, you hear people saying that, address those directly if you can. The offensive comments. The biggest thing is try to resist the urge to put other people in a box. Here we mainly talked about the male-female box, but there are lots of other boxes that we try to put people into. So as much as you can, try to resist putting other people in a box, unless you like being put in boxes. I didn't think so. Again, please like this video if you learned something new or helpful. Subscribe for more videos. Definitely watch my gender reveal video. It's on a related topic, and my sexual orientation video on a similar topic below. If you have any questions that you don't want to put in the public comments, feel free to reach out to me on any of these social media platforms. There we go. I love informing, training, teaching, learning. Again, if you have an event related to LGBTQIA allyship, I'd love to support depending on, the event and time and all those things. But if you want a training on this population, I encourage you to search out LGBTQI professionals who are versed not only in this content and this knowledge, but who live it every day. I'm also able to offer referrals to practitioners, at least in my local community, if you're looking for a psychologist or counselor who's affirming. If you need help finding a counselor or psychologist, therapist in another geographic area, I will do my very best to assist you, though I can't promise you that I know them personally if they're outside my local area. So I look forward to hearing from you in the comments. Thanks for hanging around and watching the video.